Hi, I'm Amanda Rowan, founder and head coach at the Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or clicking on our logo. Thanks. Today's topic: free MFT practice question, personality disorders. If you are preparing for the California MFT clinical exam or the National MFT exam, a topic that could very well be tested on your exam is personality disorders. We constantly hear people casually labeling others as narcissistic, borderline, or antisocial, to name a few. However, when working as a mental health professional, these personality disorders have specific criteria we must be familiar with before considering this cluster of diagnoses. So what are the distinguishing features of personality disorders? Personality disorders are 1. Generally egosyntonic. Egosyntonic means that the person does not have awareness of having the disorder. This is the opposite of something that is ego-dystonic, which means that the person knows they have it and clearly is suffering from it. So an example of ego-dystonic would be somebody who can clearly state they have depression or they have anxiety. But with personality disorders, they are egosyntonic. The person lacks awareness about it being a problem. 2, personality disorders are characterized by unhealthy and rigid patterns of thoughts and behaviors. 3, they are frequently linked to dysfunctional relationships, problems in employment, and academic challenges, and general challenges in social settings. Let's test your knowledge of personality disorders in this week's free practice question. A 50-year-old man seeks individual therapy on the advice of his lawyer. The man is quick to share that he is the owner of a very successful company that he built from the ground up and that has revolutionized how people function. He explains that he and his wife are going through a divorce. He states, "She never showed me the respect, love, or attention I deserved, and even though she wants custody of the kids, she has no right to ask for any of my hard-earned money." He explains that he is revered at work. While he is always working hard, it's worth the sacrifices because his staff and professional community recognize his talents and importance. Which of the following diagnoses should the therapist consider for this client? A. Histrionic personality disorder. B. Narcissistic personality disorder. C. Bipolar disorder. D. Antisocial personality disorder. The correct answer is B. According to the DSM-5, narcissistic personality disorder is characterized by an ongoing pattern of grandiosity, continual need for admiration, and lack of empathy for others. We see this very clearly in the vignette. The client is divorcing his wife for her failure to see him as he sees himself. He seems to need respect, attention, and love. In addition, his description of his company and its effect on society are illustrative of a sense of self-importance. Finally, the client's description of how he is perceived by others at work and within the professional community. Answer A is incorrect. For histrionic personality disorder, you need to see the client engaging in attention-seeking behaviors, usually cute or overly sexualized. Bipolar disorder is a differential diagnosis for narcissistic personality disorder. Grandiosity is also present with mania, and depressive symptoms are likely to occur when a person's ego is injured. The grandiosity can be seen in this vignette, but there are no depressive symptoms. Finally, answer D, antisocial personality disorder, is incorrect. We do not see behaviors that indicate a pervasive disregard for rules or the rights of others. There is a disregard for his wife and children, not wanting to give them money. However, it is very specific, not pervasive, and it is in response to her harming his ego. Thank you so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, We offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.